Good afternoon, everyone. Thank you for joining today's LEAP Health Information Technology Notice of Funding Opportunity. Today's agenda includes an introduction of speakers, reminders and housekeeping, background and overview, application review, process, and application evaluation. Today's speakers include Mr. Kevin Cheney, Senior Program Manager of ONC's Chief Scientist Division. Our second speaker is Ms. Tracy Akubo. She is a Program Analyst of ONC's Standards Division. Today's third speaker is Mr. Adam Wong. He's a Program Analyst for ONC's Technology Strategy and Operations Division. And today's final speaker is Ms. Lynette Perry-Young. She's a Grants Management Support, ONC Procurement, and Grants Management Division Representative. Just a few housekeeping reminders before we get started with today's webinar. This webinar is being recorded and will be made publicly available on www.healthit.gov. All phone lines will be muted during today's presentation. If you have not yet muted your phone line, please do so now. If you have questions, please enter them in the chat box or raise your hand. All questions will be answered in the form of an FAQ and will be made publicly available each week on www.healthit.gov under the topic ONC Funding Opportunities. During today's presentation, if you'd like to ask a question, please follow the instructions provided on the right-hand side of your screen. Make sure your Q&A function is enabled, and then write your question to the panelists using the box provided below arrow 2. All questions will be answered in the form of an FAQ after the presentation is finished. If you have additional questions after today's webinar, please direct them to the following email address: onc-leap@hhs.gov. We will now begin today's presentation. Tracy, I'll hand it over to you.
Thank you, Ashley. Good afternoon, everybody. My name is Tracy Akubo. Just a background on the Leading Edge Acceleration Project, or LEAP. ONC released it on June 29th. It's the Leading Edge Acceleration Project, LEAP, in Health Information Technology Cooperative Agreement Notice of Funding Opportunity, or NOFO. This has two interest areas. We will have one award per area of interest, each at $1 million. The period of performance is for 2 years. Applicants may propose 5 years, subject to availability of funds and meaningful progress. Letters of intent are due by July 17th, 2018, and applications are due by August 17th, 2018. LEAP seeks to address well-documented and fast-emerging challenges inhibiting the development, use, and/or advancement of well-designed, interoperable health IT, which is scalable across healthcare industry. Solutions are expected to further a new generation of health IT research and inform the development, implementation, and refinement of standards, methods, and techniques for overcoming major barriers and challenges in an innovative fashion as they are identified. The first interest area tends to expanding the scope, scale, and the utility of population-level data focused on application programming interfaces, or APIs. The second interest area is to advance clinical knowledge at the point of care. Interest Area 1 and its associated objectives. Interest Area 1 is expanding the scope, scale, and utility of population-level data focusing on application programming interfaces. The associated objectives are to reducing provider burdens associated with reporting through technology. Number 2, investigating and assessing trade-offs associated with various big data formats. And number 3, technical and legal or policy challenges to the scope and scale of FHIR-based APIs for these purposes.
For Interest Area 2, Advancing Clinical Knowledge at the Point of Care, There are 4 associated objectives. The first is emerging innovations in clinical medicine. Investigate new and emerging methods to create data-driven resources or tools necessary to advance evidence delivery. Explore the gaps and barriers innovative approaches. Investigate clinicians from diverse care settings and backgrounds to learn what would legitimately improve their point-of-care decision-making using data-driven tools and approaches whilst considering workflows and end-user design. Next slide. The second objective is data-driven medicine infrastructure, which is to investigate approaches to create high-quality training data sets that enable advanced analytics, clinical data combined with other data types, which are contextually relevant and are accurate, objective, and reliable, as well as to investigate and develop data infrastructures and standards necessary to extrapolate clinical and or contextually relevant data to be leveraged by health IT tools and capabilities. The third objective is integrating knowledge at the point of care, to utilize innovative tools and methods to rapidly synthesize disparate but relevant data and evidence into the point of care that is innovative and usable while taking into account the needs of end users, workflows, cognitive support, data integration barriers, and enhanced data visualization requirements. The fourth area is legal and policy implications for these innovative approaches, and is to assess the expected legal and policy landscapes in which these approaches would be deployed and determine whether any such legal and policy limits would need to be factored into the technology capabilities. Eligible applicants. This is a competitive funding opportunity open to public or nonprofit private institutions such as university, college, or faith-based or community-based organizations. Units of local or state government, eligible agencies of the federal government, Indian, Native American tribal governments that are federally recognized other than federally recognized and tribally designated organizations. For-profit organizations may participate in projects as members of a consortia or as a sub-recipient only. Because the purpose of this program is to improve healthcare in the United States, foreign institutions may participate in projects as member of a consortia or as a sub-recipient only. Organizations described in Section 501(c)(4) of the Internal Revenue Code that engage in lobbying activities are not eligible. HHS grants policy requires that the grant recipient perform a substantive role in the conduct of the planned project or program activity and not merely serve as a conduit of funds to another party or parties. Applicant organizations may submit more than one application, provided that each application is scientifically distinct. Deliverables. For each area of interest, applicants shall submit a draft project plan as an appendix to the application with corresponding table of key dates and milestones to ensure objectives are met within the self-contained 2-year project period. Recipients will also conduct virtual midpoint demonstrations, updates of any proposed approaches, prototypes, and or enhancements to illustrate their progress on the selected area of interest. For each area of interest, applicants shall provide a deliverable table that consists of expected deliverables which will be produced in support of execution of the cooperative agreement and the due dates.
The specific deliverables and their due dates are as follows. First, the draft project plan and timeline. The recipient will submit a detailed draft project plan that should include, but is not limited to, key milestones, identified risks and risk mitigation strategies, stakeholder coordination as applicable, and timeline. This is due no later than 1 month after the award date. Number 2, midpoint demonstration update of proposed approach, prototypes, and or enhancements. The recipient will provide ONC with a live virtual demonstration of their project progress to date. This is due no later than 13 months after the award date. Number 3, midpoint specification revisions, revised project plan, and timeline as applicable. Based on milestone and project progress up to the midpoint, in addition to feedback from ONC from the midpoint demonstration, the recipient will submit a revised project plan and timeline and initiate any specification revisions as applicable. This is due no later than 1 month following completion of deliverable number 2. Number 4, draft legal and policy landscape assessment. The recipient will submit a draft assessment that addresses the impact of legal and policy factors on project goals. This is due no later than 20 months after the award date. Number 5, the final legal and policy landscape assessment. The recipient will submit a final assessment that addresses the impact of legal and policy factors on project goals. This is due no later than 22 months after the award date. Number 6, the submission of final approach and, if applicable, prototypes, for example, computer software, including all associated code and tools, and or enhancements, as well as making prototypes publicly accessible for approval by ONC. This is due no later than 23 months after the award date. Next slide, please. Key milestones are developing an initial 2-year project plan, delineating components that will complete in 2 years, as well as longer-term components if proposed. Next, establishing a technical expert panel to review research methods, results, and provide guidance. Next, implementing the plan to translate project outcomes into broader uptake. Next, scheduling and conducting, as appropriate, and participating in expert panel meetings, team meetings, and stakeholder meetings. Next, conducting and managing project to conclusion in 2 years. Next, conducting and managing the long-term projects to significant demonstrable progress in the out years if awarded. And finally, communicating findings through appropriate mechanisms and making available as they are generated. Next slide, please. So the NOFO timeline is as follows. The NOFO was publicly released on June 29th of this year, and the project will finish August 17th. The notice of intent is due July 17th, as previously stated. The application period ends August 17th. The recipients are targeted to be announced by or on September 19th, and we anticipate the period of performance beginning September 24th.
And now, funding, eligibility, and application information. This type of award is a cooperative agreement with available funding per award up to $1 million each. There will be 2 awards, and as we mentioned before, the application due date is on August 17, 2018. The anticipated award date is September 19, 2018. The performance period will be of 2 years, starting September 24th, 2018, and going until September 23rd, 2020. Again, the anticipated start date would be September 24th, 2018. Notice of intent. Applicants are encouraged to submit a non-binding email notice of intent to apply. Please submit by July 17th, 2018, 11:59 p.m. Eastern Standard Time. In your notice of intent, please identify the name of the applicant, your organization type, city and state, as well as indicating the NOFO number, which is NAP-AX-18-003, with the title Leading Edge Acceleration Projects, parentheses, LEAP, in Health IT, and send to onc-leap@hhs.gov. For the application process, applicants must submit all material electronically through grants.gov. This process is outlined in the Notice of Funding Opportunity, NOFO. For assistance with submitting applications on grants.gov, please contact the grants.gov help desk at support@grants.gov or call 1-800-518-4726. Have a Dunn and Bradstreet D&B Universal Numbering System, or a DUNS number. Register in the System for Award Management, SAM, at www.sam.gov. Allow a minimum of 5 days to complete the registration. If you are already registered in SAM and have not renewed your registration in the last 12 months, you must renew your registration and ensure the application meets the application requirements and page limit. The application is composed of the following: the project abstract with a limit of no more than 500 words, a project narrative 35 pages worth, Form SF-424, the application for federal assistance, there is no limit, Form SF-424A, budget information for non-construction programs, no limit, Form SF-424B, assurances for non-construction programs, no limit, Form SF-LL, disclosure of lobbying activities, there is no limit, budget narrative, no limit, letter of commitment, no limit, proof of nonprofit status, if applicable, no limit, and indirect cost agreements, no limit.
Project abstracts. Applicants shall include a one-page abstract that represents a high-level summary of the project. Applicants should prepare a clear, accurate, concise abstract that can be understood without reference to other parts of the application and that provides a description of the proposed project, including the project's goal or goals, objectives, overall approach, anticipated outcomes, products, and duration. The applicant shall place the following information at the top of the project abstract. This information is not included in the 500-word maximum. Project title, applicant name, physical address, contact name, contact phone number, and email address and website address if applicable. The project narrative should address the elements articulated in the program description, purpose, and structure and approach sections of the NOFO. Alignment with the performance goals, program milestones, and merit review evaluation criteria presented in the NOFO. If an application does not follow the outline format, it will not be considered for further review. Format should be double-spaced and no more than 35 pages, formatted to an 8.5 by 11 letter-sized plain white pages in either Cambria or Times New Roman font with 1 inch for larger margins and font size 11 or greater. Your project narrative should include the following components. These components will be counted as part of the page limit. The suggested length for this section given below are guidelines to help applicants create a balanced document and not mandatory restrictions. Research area of interest, vision statement, and key challenges, 2 to 3 pages. Proposed approach, 10 to 14 pages. Project team, 2 to 3 pages excluding biosketches. Plan for disseminating and transitioning appropriate research results into practice, 2 to 3 pages. Stakeholder coordination, 2 to 3 pages. Project management, 3 to 5 pages exclusive of project timeline and organizational chart. And then organizational capability, 2 to 4 pages.
Research area of interest, vision statement, and key challenges. This section should offer the applicant's conceptualization of the selected research focus area. This should also include, from the applicant's perspective, a specific delineation of the objectives and research challenges the proposed project will address, specifically distinguishing between challenges that can be addressed in self-contained project period of 2 years and future challenges requiring longer, 3 to 5 years. Applicants must clearly state which area of interest the proposed project will address. And again, the format, double-spaced, 2 to 3 pages is suggested, but not mandatory, formatted to 8.5 by 11 inches, letter size, plain white pages, either Cambria or Times New Roman font, 1 inch or larger margins, and the font size 11 or greater. Proposed approach. Project approach should provide a clear and concise description of the approach the applicant is proposing to use to conduct the research and development work, including identifying the major challenges in the focus area and how to advance the field via proposed activities to meet the objectives of that specific research area. The development or employing of novel concepts, approaches, methodologies, tools, or technologies, or combination of common research elements in an innovative fashion should be described, and how it will generate much-needed insight to inform the field of health IT. Additionally, the approach should include proposed strategies on how the results of the project may be disseminated and transitioned to the field at large. Proposed approach continued. The approach should include as much detail as possible given the page limitation. Notwithstanding, the plan for each activity, at a minimum, must state A, specific aims, B, previous work of the investigative team on which the proposed research is directly based, C, the methods that will be applied, the anticipated outcomes of the work and their potential significance in addressing the challenges of the focus area being addressed, and D, the key personnel who will be involved. And again, for format, double-spaced, a 10 to 14 page frame, which is not mandatory, formatted to 8.5 by 11 inches, plain white pages, either Cambria or Times New Roman font, 1 inch or larger margins, and font size 11 or greater.
Plan for disseminating and transitioning appropriate research results. Excuse me.
Looks like we've missed the slide. Project team, sorry about that. Project team. This section must describe the proposed research team's expertise and experience to include the following: a project director, principal investigator. At least one person on the proposed research team must possess health IT expertise. For Research Area 1, the proposed research team must have expertise in the following areas: data standards development and balloting expertise, API development, and EHR integration expertise. For Research Area 2, the proposed research team must have the expertise in the following areas: user-centered design, data visualization, and cognitive support. The application should include a bio sketch for key personnel. Again, format double-spaced, recommended 2 to 3 pages, but not mandatory, formatted to 8.5 by 11 inch, letter size, plain white pages, in either Cambria or Times New Roman font, 1 inch or larger margins, and font size 11 or greater. Adam?
Just so excited about this dissemination plan. So, the plan for disseminating and transitioning appropriate research results to practice. This section should describe a plan for engaging health IT stakeholders and interested groups in promoting the dissemination and transition of appropriate research activities and results into data standards, data infrastructures, health IT products, tools, and best practices. The plan should be specific in proposing activities that will disseminate and transition the results of the proposed self-contained 2-year projects in products and best practices. And collaborative arrangements with industry and other groups outside the applicant's institution should be accompanied by appropriate letters of support. Again, the format should be double-spaced, 2 to 3 pages, formatted to 8.5 inch by 11 inch or letter size, plain white pages, either Cambria or Times New Roman font, with 1 inch or larger margins and font size 11 or greater. Stakeholder coordination. This section should describe plans to establish and operate a technical expert panel of relevant and appropriate stakeholders, including the names of members who have committed to join or propose to join to help inform the work to be conducted on the relevant research area of focus. The format, again, double-spaced, 2 to 3 pages, formatted to 8.5 by 11 inch or letter size pages, 1 inch or larger margins, and font size 11 or greater. Project management. This section should include a clear delineation of the roles and responsibilities of the principal investigator, participating researchers, project staff, consulting and collaborating organizations, and how they will contribute to achieving the research objectives and outcomes. The application includes subrecipients with contractual relationships. Plans for coordinating research activities across multiple organizations should be described. This section should specify who would have day-to-day responsibility for key tasks such as leadership of the project, monitoring the project's ongoing progress, preparation of reports, and communications with other collaborating organizations and ONC. Recipients will be required to maintain information relevant to achieving proposed milestones and performance-based milestones. Management continued. The application should describe the approach that will be used to assess project performance and monitor and track progress toward meeting key milestones. The application should include a detailed project timeline as an appendix that incorporates those milestones. It should also include an organizational chart as an appendix that reflects roles and responsibilities. The format, again, double-spaced, 3 to 5 pages, formatted to 8.5 by 11-inch or letter size plain white pages, either Cambria or Times New Roman font, 1-inch or larger margins, and font size 11 or greater.
Organizational capability statement. The organizational capability statement should outline the established research program relevant to the research focus area and highlight established collaborative relationships with healthcare stakeholders. The statement should highlight potential strategies the organizations may employ in an effort to sustain research efforts beyond the scope of the project timeframe. It should also include the relevant organizational resources available to perform the proposed project, for example, facilities, equipment, and other resources. The statement should also highlight capabilities of the applicant not included in the program narrative. Applicants who are working with partners as part of a consortia must also provide letters of commitment from their proposed project partners. The letters of commitment shall be included with the appendices and will not count towards the 35-page limit. Format shall be, again, the format is double-spaced, 2 to 4 pages, formatted to 8.5 by 11, plain white pages in either Cambria or Times New Roman font, 1-inch or larger margins, and a font size 11 or greater. Budget narrative and budget forms. Applicants are asked to complete the following budget forms to document costs of the proposed project activities. Budget narrative on how the proposed budget aligns with the applicant's project narrative. Application for federal assistance, Form SF-424. Budget information for non-construction programs, Form SF-424A. Assurances for non-construction programs, Form SF-424B, and disclosure of lobbying activities, Form SF-LLL. Detailed budget instructions are provided in the NOFO.
Next section.
Now we will have application responsiveness and objective review. Application review process. Submit all application materials electronically through grants.gov. Grants.gov issues an email receipt upon successful submission. An ONC issues receipt upon successfully obtaining files from grants.gov. Applications are reviewed for responsiveness and categorized as passed or failed. All applications that pass the review for responsiveness are forwarded for objective review. Once objective review is complete, ONC will make an award. ONC is not obligated to make an award if none of the applications meet the intent of the program requirements or if funding levels or availability changes. Next slide, please. Application responsiveness criteria. Applicants not meeting the following completeness criterion will be administratively eliminated and not sent for merit review. Number 1, the applicant meets the eligibility criteria. Number 2, the application is reviewed by the deadline required by August 17, 2018, 11:59 p.m. Eastern Standard Time through grants.gov. The application contains all required components, program narrative SF-424. The application meets all formatting and length requirements. Appendices and attachments are not used as mechanisms to exceed page limits for the project narrative.
Merit review criteria. Responsive applications are forwarded for merit review. Merit review conducted by a review panel of at least 3 experts in their field from academic institutions, nonprofits, local and federal government agencies. Applications can receive a maximum of 100 points using the following scale. Understanding of project purpose, 10 points. Approach and activities, 40 points. Applicant capabilities, 30 points. Budget, level of effort, and justification, 20 points. Merit review criteria, understanding of project purpose, 10 points. How well does the application address the purpose and objectives of this NOFO and identify a specific research area of interest? To what extent is the proposed project and activities parallel to the NOFO goals and objectives associated with one of the 2 identified areas of interest? The extent to which the applicant has identified an important, coherent, and parsimonious set of challenges and associated research questions within one of the 2 identified areas of interest that are, or if not addressed, will be clear barriers to advancing interoperability and or advancing clinical knowledge at the point of care. The extent to which the applicant describes how the project and expected outcomes will inform the field in future health IT development, research, and implementation as appropriate. Merit review criteria, approach and activities, 40 points. The extent to which the proposed research methods promise to address the challenges with breakthrough findings on a proposed timeline within the parameters of a self-contained 2-year project period and potentially longer project period if funded, 20 points. The extent to which the applicant proposes a clear and detailed transition dissemination plan, the extent to which the plan to transition or disseminate results to products and best practices is complete and feasible, and envisions the release of the outcomes of their research into open source communities is worth 15 points. The extent to which the plan describes a project management approach for ensuring project success within and across collaborators, up to 5 points. Merit review criteria, applicant capabilities, worth up to 30 points. The subsections, strength of evidence that the project brings an appropriate level of research and technical knowledge and expertise for the chosen focus area, and strength of evidence that the project will integrate the efforts of those team members is worth up to 20 points. Extent to which the proposed activities bring all the resources necessary to perform the proposed work and the identification of proposed strategies to complete activities within a 2-year time frame and sustain research efforts beyond the project time frame is worth up to 5 points. Extent to which the scientific environments in which the work will be done contributes to the probability of success, employs useful collaborative arrangements, and has evidence of institutional support, up to 5 points. Merit review criteria, budget, level of effort, and justification, worth up to 20 points. Subcriteria, is the use of consultants and or subrecipients appropriate and adequate to advance the project in accordance with the timelines, up to 10 points. Extent to which the budget is justified with respect to the adequacy and reasonableness of resources requested and the amount of the budget allocated to administration is minimized while still allowing coherent management of an integrated project, up to 10 points. Questions. All questions must be submitted in writing either via the chat box during this webinar or email to onc-leap@hhs.gov. All questions will be answered in the form of an FAQ and be made publicly available each Monday at https:// www.healthit.gov/topic/ONC-funding-opportunities/leading-edge-acceleration-projects-leap-notice-funding-opportunity. It's a mouthful. Thanks.
Thank you. At this time, we will have questions and answers that have been submitted in through the chat box. I just want you to know that all the questions that you've submitted thus far will be submitted through we will be collecting them, and they will be submitted through the FAQs, and they will be released every Monday. Thank you so much for attending. This line will remain active so that we can continue to collect these questions for the remaining 5 minutes. Please submit any questions during this particular time while the line is active. To see the NOFO on grants.gov or to apply, go through http://www.grants.gov/web/grant. View opportunity, HTML?ops LD equals 306704. I repeat, equals 306704. For assistance with submitting applications in grants.gov, please contact the grants.gov help desk at support@grants.gov or call at 800-518-4726. I repeat, 800-518-4726.